Hello and welcome, everyone. This is the third in a three-part series, Protecting Our People, a discussion about workplace violence in home-based care. I'm Dr. Danielle Perotti, registered nurse, clinical associate professor, and director of undergraduate nursing at Idaho State University. In this series, we're discussing the growing problem of violence, verbal, physical, and sexual violence against home-based caregivers. Although the data is sparse, some recent research reports that over 2/3 of all home care employees have experienced some kind of violence in their daily work. This violence leads to serious physical and emotional harm, ultimately resulting in burnout and turnover and poor quality of patient care. In our first two sessions, we've talked about the scope of the problem, discussing how frequent and how pervasive this has been over decades. We have also talked about the cultural issues that support this and have allowed the issues of violence to be somewhat hidden. As one of my guests said, the dirty little secret of home-based care. And we worked to try and unpack some of those cultural issues, including some very deeply held beliefs of nurses that we are at our heart martyrs and we sacrifice ourselves to the patient. We also talked about issues of the communities, the rise in violence in general in the country and how that is impacting all of our experiences, and some real challenges with the business needs of productivity and patient rights, and how all of these are components that leaders need to be thinking about as they start to approach the challenges of workplace violence in home-based care. Today, I am very grateful to once again welcome back my panel as we begin to explore some solutions and some actions that leaders can begin to take when they are motivated to address this challenge. So please let me introduce my guests, Andrea Devotie, the Executive Vice President for the National Association of Home Care and Hospice, Lori Bonderson, the Director of Quality and Compliance for Avera at Home, calling in from South Dakota, and Jeff Salter. I'm sorry, Jeff, got hung up on that, the founder and CEO of Caring Senior Service, calling in from San Antonio, Texas. Thank you and for once again joining for this very, very meaningful conversation, everyone. If I could, I'd like to actually get us started in our last discussion. Lori teased us a little by mentioning an employee training program that had been implemented at Avera for employee safety. I'm hoping, Lori, you can shed some more light and share that story of what that work is.
Yes, I sure can. And I just want to also emphasize that the training component of a safety program is just one piece of it. My organization chose to roll out a prepackaged program that had about 4 levels of training, with the first level being a very basic training on verbal de-escalation. And it went all the way up to a 6 or 8 hour in classroom training that included a self-defense component, and that was carried out for people that generally would work directly with patients that may have issues around violent behavior. So in home care, we elected to do verbal escalation, where our frontline people were required to take 2 full hours of training around verbal de-escalation, because that we believed was the most important component for the home care providers to kind of know and understand. In terms of a safety program, though, I will say when you do training once per year for anybody, and ours is offered annually and required annually, a whole year can go by before anyone has to deal with an issue, or maybe months goes by, and pulling on that once a year training really isn't the way to sort of say, well, we've dealt with safety in our organization. You have to look at a whole bunch of other components too, including your policies around safety. Ours are very specific. We carve out each different issue that a nurse or a frontline person may deal with, and we address it specifically. Our processes for reporting events or even near misses that are safety related, our data tracking so that we're looking at what kinds of safety incidences are we encountering, our education, which is ongoing with staff. We have a safety committee that looks at all of these things. And on our safety committee are frontline people. So our organization has taken the perspective that if we don't have a well-rounded safety program that addresses all of those different elements, that we're probably not doing due diligence to the topic of safety in home care.
That is a huge organizational commitment. That's a lot. Very impressive, and it is quite a bit. I think one of the things that you really brought out in this is levels of training and levels of engagement. And I'm curious about Andrea or Jeff, when you're listening to Lori talk about this, what is your reaction?
For me, it's just good to see that an organization has been able to address it and have a what it sounded like a proper elevated levels for different workers. So you've got the front line that needs the basic training that provides them a level of confidence, but then it goes all the way up to people that are going to experience this, where they can. It's predictive in some degree that they're going to experience some kind of violent behavior and that they're caring for maybe people that are prone to that. And that's something that they are able to then have further training. That's kind of an amazing aspect, and I think it's a interesting model, and I'm sure it wasn't easy to implement. And there's certain levels that probably could be addressed at an earlier level, and then you kind of ratchet up. So I think it's just a testament that this can be done. Is the other aspect of it, something that can be accomplished.
I would agree. And I just wanted to add in, I think it's also commendable that you're tracking data of people having close calls or real events, as well as it sounds like what's come of them. And if additional trainings are needed, you're acting on the data that you're gathering and you're maintaining documentation of it, which is a big commitment. That's great.
We are just in the beginning stages. Don't get me wrong. It's not rolled out perfectly. We are still working through some of the bugs around it, but we feel like we're on the right track, and that this will send the clear message to our people that this is important, that it's important enough to devote time and attention to it, and that the leadership supports this as an initiative for Avera at Home.
I think what I'm hearing is that you've really adopted a quality perspective and many of the techniques of moving any kind of quality measure forward into this plan. It sounds like the idea here is that employee safety is a strong outcomes measure, and that you're applying the same types of techniques that you would use to reduce medication errors in terms of committees and various levels of training and an organized approach to collecting data backed up by some policy statements. And those are all really strong pieces of any kind of quality improvement project. I have to ask, what was the reaction to this implementation? How did people respond when the idea of we're going to have a safety committee and talk about risks of violence? How did people feel about that?
At the leadership at Avera at Home, it was really well supported. I mean, that just even bringing up the topic to the leaders of the organization caused a lot of dialogue and discussion and enthusiasm for this kind of initiative, because we can all think of examples of things that have happened that we've heard about, or some of us have even seen in person, and we just didn't have the structure to be able to deal with that in a way that was, I don't know, I guess in a way that was effective. Um, we needed some foundation, and we recognize that, and there's just a lot of support now. Having said that, we are asking for time from our frontline people to attend meetings, to perhaps help us to review policies and processes, to help us figure out what educational topic is going to roll out for that quarter or that month. We're asking for people's time, and that's really hard. They are busy. They have jobs to do, and we know that, so we're trying to be very sensitive to that as well. But we felt like if we don't have the front line involved in this, that it is just more coming from us out to them rather than being built from the ground up.
You remind me of several comments from our last episode, in that this idea that kind of everybody sort of knew it was there. Again, I will quote Andrea as the dirty little secret. Everybody knew it was there, but that feeling of there's nothing I can do about this made it the silent issue. And that what you're describing is really opening the door to say, actually, we can do some things here. And it also reminds me of some comments that Jeff was making in our last conversation about that critical nature of the two-way conversation, the communication between the leaders and the people who are going into the home, and every other role in the organization, in having a shared conversation. That is, I'm going to pose for you all to boo me out of the room, but to me, that sounds like the step one for the leader, is to be able to say, okay, I don't know how I'm going to address this, and I know I can. I know I can if I start some conversations. Andrea, I know that this is work that NOC took on in some recent work groups that you had, and the call to action that was produced with Johns Hopkins. Maybe you can pick up from there and talk a little bit more about what that group's thought process was around how a leader begins to address this problem.
Thanks, Danielle. We talked a lot about the various reasons that and how we thought a leader should address it. Most of our conversation, and Lori can certainly jump in if I misspeak, but evolved around the listening piece. And that the leadership really did need to listen to what was being said, or if someone was speaking to them, and have that awareness of what's going on in their internal and external communities. And there was a lot of dialogue, and a lot of people are in different places because work has been done. It's not that home care companies have totally ignored safety, but it's always been, is it raised to the level that Lori's organization has raised it, where it's accepted? And that's where we decided we had to educate to get people to understand that it really is a pillar. That safety of our employees, without them and those people that take risks every day going into the home, we don't have an industry. And that's where things evolved.
From my perspective, I wish I could say that I'm here today because this was an issue that I just discovered and wanted to be more of a champion for. But the reality is that this issue was only brought to my attention because of the work that NAC did on the issue, to say, hey, Do you know that your workers, one of their number one issues is safety? And so for me, it's simply a matter of dollars and cents at the end of the day. And I hopefully it doesn't come across as me being uncaring of an individual, because I'm far from that. But I've got so many other issues that I'm dealing with at any given time in growing my business and trying to be a leader. This wasn't one that was on my radar. But once they told me that workers care about this that much, because workers weren't coming to me and saying, "Hey, this is a problem," and I got a pretty good a microphone out there for them to share. And it wasn't directly coming because we weren't asking the question, though, and that was the thing. They weren't selling us because we weren't asking, which kind of is that I wouldn't portray it as a dirty little secret, but it is in that sense. Um, and so that's what's good about this conversation we're having right now, and talking about solutions, which on this segment, because Lori's team recognized it much earlier than others, and they came up with some solutions. They've got a kind of a crawl, walk, run mentality, which is what leaders should do. And from my perspective, it's data driven. And if you're telling me my workers expect this, well, I want to be the company that gets the most workers. I need workers all the time. So I need to be addressing this issue if I want to be seen as an employer of choice among people. So from that sense, from a leadership, it's a no brainer, if you will. And as I said earlier, I'll use it now. But the solutions are they're all full of landmines, and so you got to be really mindful of what solution put in place, because some are very complex to put in place and very challenging. Um, but I think again, it's the discussion. Start with the discussion, and then we can kind of figure out the way forward. And I love the kind of crawl, walk, run type of attitude towards it, because you can start somewhere, and maybe it's just listening to this podcast is the starting point for people.
Well, we hope so. I do also want to come back to a couple comments you made there about leaders even on feeling that this is their place, because you're right. Unless it's a big dramatic story, it is not something that people will talk about. What I think is meaningful, and maybe an opportunity for leaders to consider, is looking at other kinds of data. So we know that when people are experiencing these ongoing situations of violence in the workplace, they are likely to leave the workplace. So vacancy rates and turnover rates is a secondary source of data. I think we could also look at things like sick calls and workman's comp issues, because when people are not identifying that they are experiencing the kind of stress that comes from ongoing verbal violence, that will play out in depression, which will often result in sick calls, or even musculoskeletal complaints. The injuries that can come from these experiences may not be big and dramatic, and employees may not want to say, "This came because someone shoved me." They may simply say, "I slipped," or it may just be an ongoing thing that manifests as a physical ailment. Back injuries are so common in our workspace, and they're so difficult to pin down to an exact experience. I would suggest that leaders consider other sources of data and think about, could those issues be related to the violence that they're experiencing when they're visiting people's homes? And I really want to explore this comment that you made about all the solutions have some landmines to them, and that is a really important one. So maybe we can talk about that for another a couple minutes here, about what are some of those issues to be considered from multiple aspects. I know I'll kick us off with, well, does talking about it make it a bigger problem?
Um, I personally think anytime you talk about it does make it a bigger problem, but that doesn't make it less important. So it needs to be discussed, and it was. I was actually also thinking about the not exactly where you're going, but as Lori was describing some of the training that their folks are doing, de-escalation procedures. If I go through a course on de-escalation, actually, that's just going to make me a better person all around. because I experience the need to use those things in daily life. Actually, we're not talking about just trying to get someone to stop at a major that's in a violent situation. It can happen in any number of situations, and I'm sure part of that training is that. And for me, that creates better customer service representatives. So there's that added benefit, but with every solution that we come up with is there's money involved. It's going to cost companies. It's not cheap to do training of any type. And there has to be a payoff in the other side. And that's why I bring that part up. Like the payoff for me, I'd flip it and say, well, yeah, the training might cost me, but I get two wins. I get an employee that feels safer and an employee that feels more valued, probably three wins. And I actually get a person that's more productive because they're now even better in customer service. So in that sense, it's multiple wins, and it's worth the investment as I look at these sort of things. At least at that level, it's pretty easy wins.
Lori, have you seen that kind of positive return?
Mm-hmm. Yeah, I was thinking, Jeff, as you were talking, that when we talk about return on investment or the cost of something, um, we can't discount how people might feel better by shining a light on the dirty little secrets, right? Like the trust in the organization and the feeling that they care about me, that they care about my safety, my well-being, my welfare, that they're looking out for us, that they're listening. Because I've heard that word a lot this past couple of podcasts, and it's just you can't really put a price on that. But I think it might show up in retention. I think it might even show up in getting people to work for you, because in our smaller communities, we know word of mouth is one of the best ways for people to find out about us and what we do. And if our employees are loyal to us because we're taking good care of them and looking out for them and we are concerned about them, that's only going to weigh in our favor when we're competing for the same employees with the organization across town. So,
well, everyone, we are coming to the end of our time. And before we close out, I'd like to invite each of you to offer a final thought to other leaders in home-based care about this topic and how they can begin to approach it. Andrea, let's start with you.
Thank you. I'm going to take the opportunity to put a shameless plug into all the work that the Work Safety Task Force did. The call to action, as well as at least 10 resources, can be found on www.nac.org. And just type in safety or look for safety, and you'll find all kinds of things that are free to help you get started. So, because it is, as our conversations have said, it's you got to start somewhere. So take that step and at least check it out.
Great. Jeff, how about you?
Yeah, I'm just appreciative of the fact that it's being discussed. I appreciate that it's been getting more national attention, and that we're taking it to the level of speaking directly to leaders, and that they have the opportunity to really understand it's an issue. And I would just advise people that an easy step is just to ask your own employees how they feel on this subject, because I think that will be probably telling for a lot of folks, because I know that it's something that I was not thinking about, but now I am, and that's important.
Thank you. Lori, last one to you.
wow, these guys nailed it. I would say that call to action provides the roadmap and gives you information about why this is important and what you can do and the things that you should pay attention to with those 5 pillars. And then I jotted down, talk to your people, have a conversation with your people, um, try to break down the barriers that they have for around culture and so forth, and establish that good culture starting from the top down. And I think that's where you start.
Thank you all so much. It's hard to summarize all of this in just a few sentences. I do want to just appreciate your efforts here as we've tried to explore just some of the data and scratch the surface around this issues of workplace violence in home-based care. It is a common conversation in today's environment about both violence in the community and violence, unfortunately, in our hospital settings. And we need to be improving the conversation about the violence that our home health teams are at risk for as well. The data is currently suggesting that home health workers are second only to law enforcement in their experience of violence in the workplace. These conversations are hugely important. And I thank all of you for bringing your expertise and your knowledge and your experience, helping us to uncover some of the issues that contribute to this situation, some of the long-held cultural beliefs, some of the inadvertent, I just didn't even know to ask about it situations that are very, very, very common with no ill intent whatsoever. Just until someone says this is an issue, this is an easy one to overlook. And I particularly appreciate the recommendations and suggestions for leaders to begin to approach this challenge, to think about it as something that, yes, it is happening in your organization as well as everyone else's organization. And so to approach it with an air of curiosity and a true commitment to understanding the experience of the team members that will lead to more interventions and more solutions. Thank you all so very much. I look forward to further conversations about this. And once again, thank my guests, Andrea Devote from NOC, Lori Bonderson from Avera at Home, and Jeff Salter from Caring Senior Service in Texas. Thank you, everyone.